Belle is a beautiful young woman in her mid-20s with schizophrenia. She currently lives with and takes care of her father, who is an inventor. She lives in her little French town and is currently unemployed. She enjoys reading books about fantasy worlds and singing as she completes errands in the town square.
Due to stress from taking care of her father, she had a psychotic episode. She believed she was captured by a beast and was forced to live in a castle with him and all of his inanimate objects, which dance, sing, and have conversations with her. She now is on medication and her hallucinations are limited.
One of Belle's strengths is she really likes to read. She enjoys being alone and being immersed in alternative realities. She is also independent in her romantic relationships. For example, there is a young man in her town who has shown consistent interest in dating her. However, Belle does not feel she needs a man to complete or fulfill her needs. She has a strong relationship with her father and helps to take care of him. She uses singing as a coping mechanism.
Based on Bell's past occupational performance, we believe taking a dynamic interactional model approach is a good way to address the challenges Belle faces with participation in daily life. The overall goal of this model is to see if Belle is able to recognize her mistakes as she performs the task.
Based on Belle's previous level of occupational performance, we know she has the ability to learn and apply strategies. As occupational therapists using this model, we recognize that people need to learn general cognitive strategies that will help them cope and adjust to life's changing circumstances. With this model, we can determine what tools can be used to improve her performance.
The DIM was created by Joan Toglia and OT. It's based on cognitive and educational psychology for people with brain injury. Now it's also used for people with mental illness. She noticed that her patients had difficulty generalizing their skills to other environments. The DIM takes a top-down approach. It is not diagnosis-focused, but focuses on the client's strategies, self-awareness, and external factors, including activity demands and environment.
The DIM assumes that the person is able to learn, but it does not exclude adaptations and compensatory approaches that may improve the client's performance. The model assumes that there are ongoing interactions between the individual, the task, and the environment. These interactions either facilitate or interfere with the cognitive processing required for participation.
The DIM's main focus is on increasing metacognition or self-awareness of the person. With an increase in self-awareness, a person increases feelings of self-efficacy and feels more in control of their environment. Through the use of the Just Right Challenge and Transfer Continuum, the person will learn cognitive strategies to increase occupational performance, which they will be able to generalize to unfamiliar situations.
The two guiding principles of DIM assessment are that treatment is delivered in a reactive mode and there is little emphasis placed on psychometric tests. With the DIM, it is important to assess the personal context, task performance, and the environment. These elements of Belle's participation in daily life can be assessed with interviews through the COPM and dynamic assessments.
Taking a dynamic assessment approach through observation of performance will answer the following questions. Can her performance be facilitated or changed? What cues or conditions increase or decrease her performance? What is Belle's potential for learning? This will help us determine what is interfering with her functional performance and what can be done to facilitate her participation.
Through assessments, we want to recognize Belle's uniqueness. We want to uncover her strengths and barriers that may contribute to her participation in everyday life. We can start by interviewing Belle and her father. For Belle, the COPM will be used. She will rate importance, performance, and satisfaction of task. For her father's interview, open-ended questions will be used to discover how he feels about her participation.
Videotaping Belle completing a familiar and an unfamiliar task is a dynamic assessment. It will identify Belle's strategies as well as her awareness of her abilities and limitations. Awareness questioning, cueing, and grading with Belle will estimate her potential to learn, her approach to solve problems, her preferences of strategies, and the effects of the therapist's cues on performance, allowing for establishment of a better task environment person match.
Belle grew up socially isolated due to her father's job. As an adult, she continues to isolate herself since she never acquired these skills. To avoid social participation, she reads books. Belle has an opportunity to socialize when she completes her morning errands. She gets distracted and takes 3 to 4 hours to complete errands that could be done in 1 hour. When she finally returns home, she feels guilty for leaving her father for so long.
Belle's father has gotten older and is requiring more assistance with his IADLs and work. Belle feels obligated to help him and overwhelmed with the caregiver role she has taken with her father. However, she thinks that something bad will happen if she isn't there for him. She has also wanted to get a job, however lacks the attention, initiation, and memory to obtain and maintain a job at this time.
Reading sometimes gets in the way of her making friends, which she dearly longs for. Belle was guided to make the goal of joining a book club at the community library to increase her social participation. With Belle's father's unpredictable income, Belle has determined that she needs a job for them both to maintain their lifestyle. Therefore, she has set the goal of obtaining a job in 1 month.
Belle indicated it takes her hours to run her morning errands. Belle stated that 1 hour would be a reasonable amount of time for completion. Belle's goal will be to run her morning errands in the town square within 1 hour. Belle reported increased anxiety to be her father's only caregiver. Belle identified the goal of finding a personal care attendant for her father. This will be beneficial to decrease anxiety.
The DIM encourages the development of cognitive strategies for clients to be able to be successful in both familiar and unfamiliar situations. Belle needs awareness of her own ability to perform tasks in varied contexts. Metacognitive training will increase this awareness. These interventions will be introduced one at a time to determine their effectiveness for Belle.
Some of these strategies and training techniques include self-monitoring. Belle will use checklists or self-talking throughout tasks for feedback. Time monitoring. With errands, Belle can verbalize how much time she has left. And role reversal. The therapist performs the task first correctly and then Belle points out what was done correctly and then incorrectly and gives her feedback. This will help Belle acquire new social skills.
More strategies include the transfer continuum. This gradually changes the characteristics of a task or setting. This will help her generalize her cognitive strategies and learn new ones for new situations independently. And group interventions. Some interventions will be provided in a group setting with individuals with cognitive levels above and below Belle's. This will provide peer models for her to learn from.
Although the model has been minimally used with individuals having schizophrenia, the results have been promising. Further study is important regarding this model and those with schizophrenia. Studies have shown that generalization is only achieved when it is built into the training program and that using a variety of training tasks is effective to achieve transfer of learning.